The chances of pregnancy after 40 are lower than they are at younger ages. That's a medical fact. When a couple has been trying to conceive for a long time without success, it's common for the focus to fall almost entirely on the woman. But the reality is more complicated than that. In many cases, age-related changes in the female reproductive system do play an important role. Reproductive function gradually declines, and the chances of becoming pregnant become lower. There are many reasons for these changes, and we'll discuss them in a separate video. They can all make conception more difficult. But there's another important point that's often overlooked. Conception is never the responsibility of just one person. It's something that involves both partners. That means your partner's health also matters. So, what role does the male factor actually play when a couple is having difficulty conceiving? Let's take a closer look. Research suggests that when a couple has difficulty conceiving, the male factor contributes in approximately 20 to 50% of cases. However, age makes an important difference. Before the age of 30, male infertility is considered the primary cause in about 20% of couples experiencing infertility. Among couples over 40, that figure rises to around 50%. In other words, in roughly 1 out of every 2 couples over 40, the male factor is the main contributor. This means that a man's reproductive health can be just as important as a woman's reproductive potential. It's true that, on average, men remain fertile longer than women, but that's only an average, not a rule that applies to everyone. In real life, the situation can vary greatly from one person to another. Assuming that all men maintain high fertility throughout their lives is simply a myth. So why does male fertility naturally decline with age? There are 2 main reasons. Natural age-related changes, health problems that accumulate over time. Both of these factors can have a major impact. It's difficult to say that one is always more important than the other. In many cases, it's not easy to distinguish normal age-related changes from the effects of disease. Usually both play a role, but to a different extent in different men. So, what changes typically occur as men get older, and how do they affect reproductive function? How does this happen? First, age can affect both libido and erectile function. These 2 factors are closely connected. During each menstrual cycle, there's only a limited fertile window when conception is most likely. As women get older, that window often becomes shorter. If a man has low sexual desire or erectile dysfunction, regular intercourse may become difficult. And because conception often requires multiple attempts over several fertile cycles, these problems can significantly reduce the chances of pregnancy. Second, many men over 40 develop problems with ejaculation. This can happen for a variety of reasons. Previous injuries, chronic inflammation, infections, and other medical conditions may affect the reproductive tract. As a result, semen volume may decrease, reducing the likelihood of natural conception. Third, sperm quality also changes. The amount of semen is only part of the picture. The quality of the sperm itself is just as important. Several changes become more common with age. The number of sperm cells may decrease, leaving fewer cells capable of fertilizing an egg. Sperm motility may also decline. Even if enough sperm cells are present, they must be able to reach the egg. Reduced motility lowers the chances of fertilization. The structure of sperm cells can also become abnormal. Some sperm develop 2 heads, 2 tails, or other structural abnormalities. Even if these sperm reach the egg, they are often unable to fertilize it successfully. Finally, the proportion of sperm carrying genetic abnormalities may increase. These sperm contain altered chromosomes or DNA damage. This is considered the most concerning change. Fertilization may still occur, but the risk of miscarriage, pregnancy loss, or certain genetic disorders in the baby can become higher. Not every man experiences all of these changes. Some mainly develop problems with sperm quality, while others are affected primarily by reduced sexual function. Every situation is different. After the age of 40, the overall picture is often more complex because natural reproductive aging is combined with other health-related factors. Lower testosterone levels, chronic diseases, unhealthy lifestyle habits, and many other factors can all contribute to declining fertility. So what does this mean in practice? The takeaway is actually quite simple. If you're planning a pregnancy after 40, don't assume that everything depends on your own reproductive health. Your partner's reproductive health is just as important. That's why pregnancy planning should always involve both partners. If you're having difficulty conceiving, both of you should be evaluated, not just one.